Now let's go to the next question. Disproportionate dwarfism, where do we see? We see in achondroplasia, we very much see it in pituitary dwarfism. What are the two common causes for the disproportionate dwarfism? Is it a question about all except? Except about? Yeah, okay, now let us talk about it. So whereas proportionate dwarfism, if you take doctor, it can be familial, it can be IUGR, it can be intrauterine infections, it can be nutritional dwarfism and endocrine disorders. Any of them can lead to the development of proportionate dwarfism. So between hypothyroidism and rickets, what is your choice? Hypothyroidism? Yes? Okay, cretinism or hypothyroidism, agreed. So endocrine causes primarily lead to development of a proportionate dwarfism rather than disproportionate, whereas structural disorders like achondroplasia are more likely to be responsible for the development of disproportionate dwarfism. Now where do you find the Pons fracture? It is in the skull of the infants where we have the Pons fracture is a known fact. Then upper limb to the lower limb segment ratio is 1.7 at birth and it becomes 1.3 by age 3 and it is 1.0 equal segments by the time it is the age of 7 years are the well known figures. Where do you use emergency radiotherapy? We use it for pathological fractures, spinal cord compression or any bronchogenic carcinoma. If it leads to superior mediastinal syndrome also we give the radiotherapy as an emergency. So bleeding becomes the odd man out where we don't use any emergency radiotherapy. Then do we? Any argument on that? We will have in the end to support that. Then Einham, where do you see? It is typically seen in the case of dactylolysis of toe, which is triggered by the trauma. A small part of the fifth toe may be lost. And what are the risk factors for the Einham, doctor? Continuously reading in the reading room without getting up. Please check your fifth toe. There can be a Einham which can develop. Common question in the exam. Where do you eschorotomy? Whenever there is any deep burn which is circumferential impairing the ventilation, then you need to do basically the eschorotomy is what need to be remembered. We find a retraction ring, not a constriction ring in the case of the obstructed labor. Whereas all the other three, any instrumental manipulation, intrauterine manipulation or inappropriate use of oxytocin can lead to the development of the constriction ring. So any over-efficient uterine action or inefficient uterine action comes under abnormal uterine action, and in the inefficient uterine action you have got constriction ring, hypotonic inertia and hypertonic inertia is what I like to underscore, and I leave in the literature to you the differences between constriction and retraction ring, which is a favorite topic of examiner. Now comes the most frequently discussed topic in our every Sunday exam: cluster headache, tension headache, migraine. Without that there is no question paper. So you need to know that cluster headache is recurrent, brief, sudden, unilateral periorbital pain, and it is excruciating, penetrating, and around 8 times it can occur, and the patient will be rocking, pacing his head against a hard surface. There are all the various manifestations of the cluster headache is what need to be remembered. Very classical feature which is a clue in the question given to us is lacrimation, which is there, and the rhinorrhea, lacrimation, conjunctival hyperemia, palpebral edema, Horner's, they are all the features of the cluster headache is what I want to underscore. Dorsal mesogastrium will be developing into the greater omentum, as all of you know. All except what was given? No, just dorsal mesogastrium gives rise to what? Question is correct, answer is correct. Then we had some auditory turbulence. Somebody said all except about the question. Okay, no problem. There are, I think, too many all excepts in the exam. And do you know one fact, doctor? USMLE virtually removed all except kind of questions. On the West, the people are going that way. They said that no all except about in the exam. You don't find all except questions, unlike 1980s USMLE used to have. Later on they said, what is this all except, and putting students into a split mind. Some of the questions in entrances will be not all except about. So that they want to know the Renin Martin English grammar book also you read and come. Not except become true and all that. So except, not except, all this. But actually the most challenging questions are all about except. And for the examiner, it is easy to frame a question about except. Why except questions are easy to frame? Pick up 4 true statements and put one not into one of them and say that which is except out of these 4. It is like your Chandamama book, find the differences between the 2 diagrams. So kind of questions, but anyway we have to accept it. So Wolffian's duct is basically associated with the Gartner's cyst, the duct cyst, the Wolffian duct is a known fact. Torsion is more common in the appendix of the epididymis out of all the various parts of the testis and its appendages is what need to be remembered. Then the cistron of the DNA is the one which is coding for the proteins, for the generation of the proteins. What was the option? What is called appendix of testis? The hydrated of Morgagni is called appendix of testis, okay, but appendix of epididymis is more vulnerable for the torsion from frequency, epidemiological frequency perspective. We have the appendix of epididymis, which is a remnant of Wolffian duct, and the appendix of testis, which is a remnant of paranephrotic duct. Any of them can undergo the torsion, but the frequency wise we are talking about. Now the post-sympathetic ganglion can produce dopamine and L-dopa, very well known. What are the only 2 exceptional cases where acetylcholine is produced instead of catecholamines by the post-ganglionic sympathetic? Sweat glands, very good. So it is the sweat glands in the palms. Hence when you are emotional, suddenly you start sweating into the palms. And there acetylcholine is the one which is being produced. And another is the deep muscles, their blood vessels. They are also fundamentally, there the postganglionic sympathetic is acetylcholine. So what is the effect of postganglionic catecholamine? Normally vasoconstriction. Postganglionic acetylcholine leads to vasodilatation. So that is the reason the deep vessels, the deep muscles, blood vessels, they require more blood flow when we are exercising, when sympathetic activity is high. So that is the reason post-ganglionic sympathetic neurotransmitter at the vessels going to the deep muscles instead of catecholamines, you have the acetylcholine as an exception is what need to be remembered. Clozapine is the typical antipsychotic which is specific towards a D4. It has got the least extrapyramidal side effect. Can you tell me, doctor, why the clozapine, other than being D4 specific, what is the other reason that extrapyramidal side effects are less with the clozapine? Is there any other reason? Clozapine also has some what activity? Cholinergic activity, anticholinergic activity. So even anticholinergic activity of the clozapine also will make the extrapyramidal side effects to become minimized. Easy to remember. In Parkinsonism, to control the tremor, what do you give? To control the tremor in the extrapyramidal disease of Parkinsonism, what do you give? The drugs which have got a anticholinergic effect. So that is the reason the extrapyramidal side effects of clozapine are minimal, because it is D4 specific. It also has an anticholinergic action is what you need to fundamentally remember. Then what is the main purpose of Parkinsonism treatment? Always acetylcholine and dopamine are like opposition party in the brain. If one is more relative to the other, then it leads to problems. So that is the reason our main role is to make them well balanced, which will bring a control on the Parkinsonism. Now let us talk about the various agents. Anaerobious pyrantel palmoate is considered to be the treatment of choice. Toxocariosis, it is the mebendazole. Strongyloidosis, it is the ivermectin. And the diphyllobothram, it is the praziquantel, which is considered to be the drug of choice. So what is the odd man out? The niclosamide and toxocara is the odd man out. And where do you use niclosamide, doctor? Basically, niclosamide is a teinicide, which is against tapeworm. Hence, we use it very effectively in the management of the tapeworm is what need to be remembered. Then amidaron side effects is a traditional question expected. So amidaron can lead to pulmonary fibrosis, thyroid dysfunction and also corneal microdeposits. And what is the type of keratopathy which comes with amidaron called as? It's called verticillate keratopathy. The corneal verticillata is the name given for the deposition, microdeposition of the amidaron into the cornea is what need to be remembered. Now if the patient is fully atropinized, what becomes blocked in the body? Muscarinic or nicotinic? Muscarinic receptors. But nicotinic are still intact. So if you give acetylcholine, what will acetylcholine then will do? It will go and attach with that nicotinic receptors. So what is the influence of nicotinic hyperstimulation in the body? Nicotine basically has an effect on the cardiac potassium channels, and that will set the heart into arrhythmias. And the cardiac arrhythmias is one of the complications of the nicotinic stimulation if you give excess acetylcholine in a patient who is otherwise atropinized and whose muscarinic receptors are blocked is what need to be remembered. Out of all, it is the enuresis. Did anybody debate dyslexia? Luckily not. So enuresis is a very common developmental disorder in the children is what need to be remembered.